6 dietary choices to steer clear of when managing an enlarged prostate. Enlarged prostate, medically known as benign prostatic hyperplasia, BPH, is a common concern affecting men, particularly those aged 50 and older. This condition can lead to challenges in urination, manifesting as increased frequency, discomfort in the pelvic region, abdominal discomfort, and discomfort in the area between the scrotum and anus in men. Let's delve into the underlying mechanisms at play here. As illustrated in this diagram, the prostate is a small gland situated just beneath the bladder, the reservoir for urine. Urine is then directed through a conduit known as the urethra. When the prostate experiences growth, inflammation, or enlargement, it exerts pressure on this delicate tube connected to the bladder. This is where the trouble begins, as the swelling hampers the proper passage of urine through the tube. As a result, urine may accumulate and become trapped within the bladder, leading to compromised bladder control, particularly during nighttime when you're attempting to sleep. You may experience an urgent need to urinate, often with only a small volume of urine expelled. Your urinary stream may weaken, potentially starting and stopping intermittently during urination, or necessitating straining or exertion to initiate the flow. Scientific research has elucidated that prostate enlargement is primarily driven by hormonal imbalances, wherein anabolic hormones like estrogen, insulin, and dihydrotestosterone, DHT, accumulate in the body. Regrettably, certain dietary choices have been shown to stimulate the production of these hormones, contributing to prostate swelling and enlargement. Consequently, this elevates the risk of prostatitis infections and heightens the likelihood of developing prostate cancer. In today's presentation, I will share with you the 6 foods you should eliminate from your diet when dealing with an enlarged prostate. Furthermore, I'll provide insights into simple lifestyle adjustments and remedies that can assist in reducing prostate size and enhancing urinary function. In addressing prostate health concerns, it is imperative to make informed dietary choices. Let's begin by discussing the first dietary category to avoid, which is dairy. If you find yourself grappling with an enlarged prostate, manifesting in urinary difficulties, it becomes crucial to eliminate dairy products from your diet. This category encompasses items such as butter, cheese, milk, yogurt, and cream. Dairy products, typically derived from cow or goat milk, naturally contain growth hormones intended to foster the growth of infant animals. However, these inherent hormones have the potential to exacerbate an already enlarged prostate, resulting in glandular swelling and heightened pressure on both the urethra and the bladder. It's important to note that dairy can be a valuable source of nutrition for individuals without prostate issues. Nevertheless, if you are dealing with prostate enlargement, I recommend an experiment. Abstain from dairy for a period of 1 to 2 weeks and observe any improvements in your symptoms. Now, let's move on to the second dietary component to avoid: vegetable oils. Most common cooking oils, despite their misleading label as vegetable oils, are manufactured from highly processed and genetically modified grains such as soy, corn, cottonseed, canola, grapeseed, and rice bran. These oils are notably lacking in vegetables, and they often find their way into fast foods, prepackaged meals, deep-fried dishes, store-bought salad dressings, margarine, and coffee creamers, among other products. These oils are rife with inflammatory omega-6 fatty acids, capable of inducing significant inflammation within the prostate gland, particularly affecting the liver. This is concerning because the liver plays a pivotal role in hormone regulation and the removal of surplus hormones that your body does not require. When these refined oils weaken the liver hormones like estrogen and insulin accumulate, promoting prostate growth while also diminishing the strength of the bladder walls. To address this issue, it is advisable to completely eliminate these oils from your diet, and instead opt for healthier alternatives like extra virgin olive oil, cold-pressed avocado oil, and organic raw coconut oil. Furthermore, I recommend increasing your consumption of omega-3 rich foods such as oily fish, salmon, sardines, and pasture-raised eggs. Omega-3 fatty acids have anti-inflammatory properties, which can help counteract the negative effects of excessive vegetable oil consumption. Moving on to the third dietary factor detrimental to prostate health: sugar. Whenever you consume refined sugar, flour, grains, or starchy foods, your body swiftly converts them into glucose, raising blood sugar levels. This can lead to rapid cellular damage, especially if you consume excessive sugar in one sitting. To safeguard your well-being, your body releases insulin, a hormone responsible for transferring sugar from your bloodstream into your cells to provide energy. The issue arises when you continuously ingest refined sugar in foods that convert to sugar, as your pancreas responds by producing ever-increasing amounts of insulin. Given that insulin is a growth hormone, heightened levels can prompt rapid prostate enlargement. Furthermore, the excess sugar passing through your kidneys can increase urination frequency, especially at night. To mitigate these effects, it is advisable to reduce your sugar and refined carbohydrate intake. This includes limiting your consumption of fruit juices, sweets, biscuits, pastries, breads, sodas, cereals, and all flour-based foods. Additionally, I recommend refraining from eating after 7 p.m., allowing your blood sugar levels to stabilize. This adjustment can lead to reduced nighttime urination and improved sleep quality. Now, let's discuss the fourth dietary factor: unfermented soy. As previously mentioned regarding vegetable oil, soy oil is highly inflammatory and can contribute to prostate enlargement and liver damage. However, it's equally important to be mindful of inexpensive soy proteins that find their way into various foods. Soy protein isolates, commonly found in diet shakes, prepackaged meals, vegan meat substitutes, protein bars, baby formulas, and processed meats, can lead to a substantial increase in insulin production within the body. Insulin, as a growth hormone, can exacerbate prostate enlargement and urinary issues. Moreover, soy powder elevates estrogen levels, which, in excessive amounts, can contribute to prostate enlargement. Additionally, soy is often genetically modified and cultivated using chemicals like pesticides, herbicides, and insecticides, which can disrupt hormone balance. To compound matters, soy is rich in phytic acid, a compound that can hinder the body's absorption of essential minerals like zinc, crucial for normal prostate function. For those dealing with prostate issues, I recommend a complete avoidance of unfermented soy. However, there is an exception to this rule. You may consume organic fermented soy products such as miso, soy sauce, tempeh, tofu, and natto. The fermentation process employed in these products helps neutralize the adverse effects of soy, rendering it much healthier for your body. The fifth factor that should be avoided is alcohol. Alcohol acts as a solvent that can harm your liver cells and disrupt hormonal balance within your body. This disruption often leads to elevated levels of estrogen and insulin. Excessive levels of these anabolic hormones can contribute to prostate enlargement and an increase in blood pressure, which in turn weakens your arteries and blood vessels. Therefore, it is advisable to consider reducing your alcohol consumption, particularly if you frequently consume beer, which is known to have estrogenic properties. As an alternative, you might want to think about enjoying 1 to 2 cups of kombucha tea in the early evening. This beverage can help relax your body and nervous system without the harmful effects of excessive alcohol consumption. Kombucha tea is a fermented drink that supports the beneficial microbes residing in your gut. These microbes play a crucial role in eliminating toxins from your system and enhancing bile production to maintain a clean liver and balanced hormones. Now, let's delve into the issue of processed meats. Processed meats include items like salami, hot dogs, canned meats, pepperoni, and ham. Regrettably, these meats undergo processing and are typically combined with various chemical preservatives, nitrates, dextrose, sugar, soy proteins, and vegetable oils, all of which I've previously discussed in this video. Studies have shown that processed meats can elevate the risk of cancer due to their propensity to induce oxidative damage to cells and form sticky proteins that can clog arteries and cause blood clots. Moreover, by harming your liver, processed meats also increase the risk of prostate cancer and exacerbate existing prostate issues. It is advisable to eliminate processed and conventionally raised meats from your diet, and opt for higher quality meats sourced from local farms. Ensure that the meat you choose is grass-fed, grass-finished, and organic, as this guarantees that the livestock was not exposed to hormones or junk foods. Grass-fed meats are significantly richer in nutrients and are devoid of the harmful chemicals found in processed meats. This distinction is crucial. Additionally, grass-fed beef and organ meats such as liver are abundant in zinc, heme iron, and proteins that support a healthy prostate gland and its production of seminal fluid for reproduction. I must emphasize that each individual has a unique body and biochemistry. Therefore, it is essential to experiment with eliminating different foods from your diet and observe whether your urinary or prostate issues improve. You can make more permanent dietary changes based on your observations. In the subsequent part of this video, I will share 6 lifestyle changes and remedies that you can implement to reduce the size of your prostate back to normal. But before we delve into that, let's take a deeper look at some of the most common causes of prostate enlargement, so you can gain a better understanding of what's happening. The primary and most prevalent cause of an enlarged prostate is the excessive consumption of refined foods, such as sugar, processed grains, and flour. These foods can deplete your zinc reserves, leading to higher levels of DHT, insulin, or estrogen. Additionally, being overweight can trigger prostate enlargement, as increased body fat can elevate estrogen and insulin levels, which are hormones that can contribute to gland enlargement. Another issue is that as we age, our stomach acid tends to weaken, reducing our ability to absorb essential nutrients like zinc, which are crucial for maintaining a healthy prostate. If you have liver damage, it further increases the likelihood of hormonal imbalances, as the liver is responsible for filtering out excess hormones. Non-organic foods, as discussed earlier in this video, often contain trace amounts of pesticides and chemicals that can damage your liver, leading to hormonal imbalances and potential prostate enlargement. Finally, if you already have an enlarged prostate, dairy products and processed meats may exacerbate the condition. Now, let's delve into some invaluable lifestyle recommendations to aid in reducing the size of your prostate. Incorporate a daily regimen of consuming a small portion of pumpkin seeds into your diet. These seeds are among the most formidable combatants against prostate enlargement due to their rich content of zinc, phytosterols, and vitamin E. These nutrients work in synergy to regulate hormone levels and diminish prostate size effectively. If you're grappling with urinary issues, contemplate supplementing your daily routine with 120 milligrams of stinging nettle root, thrice a day. This natural herb boasts anti-inflammatory properties that alleviate prostate inflammation, allowing for normal bladder emptying. Its mechanism of action involves inhibiting the accumulation of DHT and estrogen. It's imperative to curtail the consumption of certain foods, particularly those outlined in this presentation, with a special focus on reducing your intake of dairy, sugar, vegetable oils, and processed meats. These culprits contribute to hormonal imbalances and prostate inflammation. Moreover, if you're a smoker, it is imperative to begin reducing and ultimately quitting smoking, as it damages blood vessels and fosters prostate enlargement. To achieve hormonal equilibrium, make it a daily practice to consume a salad featuring organic cruciferous vegetables such as radishes, broccoli, arugula, kale, collard greens, or cabbage. These vegetables contain vital compounds like sulforaphane and indole-3-carbinol, which facilitate liver detoxification, aiding in the elimination of surplus hormones that fuel prostate growth. Additionally, include foods known to diminish prostate size in your diet, such as tomatoes, organic grass-fed beef, shellfish, wild salmon, and avocados. Don't forget to incorporate decaffeinated green tea into your daily routine, as it possesses properties that promote prostate health and optimal seminal fluid production. Step up your fitness game by embracing high-intensity interval training, HIIT. Just dedicating 10 minutes to HIIT workouts twice a week can substantially boost testosterone levels in men, which in turn aids in reducing the levels of other anabolic hormones like DHT, estrogen, and insulin. Regular exercise also plays a crucial role in metabolizing excess blood sugar, which could be contributing to prostate inflammation. Lastly, if you carry excess weight around your abdominal area or indulge in daily alcohol consumption, it's highly probable that you have a fatty liver, which can trigger hormonal imbalances and inflammation in your body. In such a scenario, consider adopting an intermittent fasting regimen where you consume all your daily calories within a 4-hour window and fast for the remaining 20 hours. Fasting is a powerful tool in your arsenal for both shrinking and optimizing prostate health, and it aids in the reduction of excess fat in the liver. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy.